Hello everyone, I am Dr. Angshuman Goswami, Senior Eye Surgeon in Kolkata. Every year, 14th November is celebrated as World Diabetes Day. The theme for this year's World Diabetes Day celebration is Access to Diabetes Care. On this special occasion, I would urge all diabetic patients to take special care of their eyes, as loss of vision is a common and frightening consequence of diabetes, a disease which is reaching epidemic proportions in the world today. What is diabetic eye disease? Diabetic eye disease is a group of eye disorders affecting diabetic patients, including diabetic retinopathy, early or sudden onset cataract, and swelling of the optic nerve called optic neuritis. It is also seen that there is increased chance of having glaucoma or vascular blockage in patients with diabetes mellitus. Out of these, diabetic retinopathy is the most common in occurrence. What is diabetic retinopathy? These are the changes that take place in the retina of diabetic patients, which can ultimately result in loss of vision and eyesight. It is the commonest cause of loss of vision due to any systemic or bodily disease. What are the symptoms of diabetic retinopathy? In its earliest stages, diabetic retinopathy may not cause any symptoms, and a decrease in vision may present much later in the day. By this time, the disease process has advanced considerably. Thus, the importance of early detection and treatment by regular screening of diabetic patients. Early detection and treatment can prevent blindness in more than 50% of the patients. How to detect diabetic retinopathy early? All newly diagnosed patients of diabetes mellitus must be screened for diabetic retinopathy at the earliest, and subsequently every 6 months to a year, depending upon the stage of disease. This involves a comprehensive eye checkup by an ophthalmologist after dilating the pupils, and some tests may be required. What causes vision loss in diabetic retinopathy? Diabetic retinopathy can cause loss of vision by causing swelling in the macula, the most light-sensitive central part of the retina, or it can cause a hemorrhage in the eye, or at times it can cause a detachment of the retina from its normal position. It may also involve all of these in causing a fall in the vision. How do you prevent progressive diabetic retinopathy? Diabetic retinopathy can be prevented from progressing by making lifestyle changes, like having a healthy diet, exercising, quitting smoking, and taking medication that keep the blood sugar under control. It is also very important to control other systemic disorders of the body, such as hypertension, hyperlipidemia, and kidney dysfunction. How is diabetic retinopathy treated? Diabetic macular edema or swelling of the retina is treated with injections of anti-VEGF or by laser or a combination of both. Those with advanced disease may require multiple doses of injection, laser, and less often surgery. Fortunately, most of these treatments are carried out on an outpatient basis or on a daycare basis and do not require stay at the hospital for too long. Hope I have been able to educate you about diabetic eye disease and its treatment and allay your fears and anxieties about it. I hope it will encourage you to get your eyes examined regularly by an ophthalmologist. To know more about eye and its diseases, follow me on Instagram, Facebook, and YouTube. For any further queries, feel free to contact me on my WhatsApp number 8826200133. I'll repeat 8826200133. Hope to see you soon with many more such educative videos. Thank you and goodbye.